Hello, my name is Pauline RN. Welcome to my channel. The title of my video is Death and Dying Part 2, Questions and Answers from Nclex RN Examinations. Please hit the thumbs up, please subscribe, and please share this video. Thank you. My first question, what factors influences response to grief? The correct answer is developmental level. Older adults have experienced more deaths. Next, psychosocial, spiritual, cultural, socioeconomic states, support systems, depression, personal relationships, nature of loss or trauma. These are all factors that influence response to grief is the correct answer. My next question, what should be the nurse's response to dying patients and family? The correct answer, the nurse should listen to patient and family. Empathize with patient and family. Note therapeutic communication, open-ended. Use silence. Listen to patients' concerns and families' concerns. Allow family and patient to verbalize feelings. Is the correct answer. Next question. What will be your nurse's assessment in relation to grief? What will be your nurse's assessments in relation to grief? The nurse, sometimes patients come in the hospital and they have family members who have just expired. So bear that in mind also. What should be the nurse's assessments in relation to grief? The nurse should assess sleeplessness, assess depression, assess loss of appetite, loss of anxiety, suicidal ideation, assess if patient families, if they need a clergy or a pastor, assess decreased concentration, assess empathize with patients, cry with patients, allow patient and family space and time to grieve and connect, decrease loud noises. These will be on nurse's assessment in relation to the grief response. Next question. When death is close, what will be the nursing intervention? When death is close, nurses should remember that the hearing is the last to go. Continue talking to the patient. Encourage the family to continue talking to the patients. Educate the families concerning the stages of death and dying. Is the interventions for the patient who is close to dying. Our next question is, what are the signs and symptoms of near death? Correct answer: decreased appetite, difficulty swallowing, will make this patient NPO. The patient will have blue and purple patches over skin, cyanosis, note the arms and the legs. Patients will become incontinent, low urine output. Note apnea, confusion, decreased loss of consciousness is the correct answer. Next question. What is the sign and symptoms of imminent death? Correct answer is dilated, fixed pupil is the correct answer. What should the nurse do at time of death? Correct answer: replace the dentures. Ask the patients and family if they need the clergy or a pastor. At the time of death, note the time. Call the doctor to come and pronounce the patients as being dead. Call the doctor to come and sign the death certificate. Next question. What are your comfort measures for your dying patients? Correct answer: administer pain medication, IV drips. Example, morphine. We will administer oxygen as needed. Patient will have labored breathing, apnea, difficulty breathing. Next question is concerning organ donation. Who is responsible for communicating about organ donation? The correct answer: the registered nurse should never ever communicate anything about organ donation to the family. Never ever. At the time of death, you have 1 hour time to communicate with the organ donation bank. Make sure the doctor comes immediately to pronounce the patient as being dead. But you have no more than 1 hour to communicate on the phone with the organ donation bank. The RN is not her responsibility to communicate to the family concerning organ donation. It's the responsibility of the bank. You'll give them the phone numbers of the next of kin, and the organ donation bank will communicate to the family. Next question. What is palliative care? Correct answer: approach that improves the quality of patients' lives and family facing life-threatening illness through prevention of suffering for patients with chronic illnesses or diseases. Palliative care offers physical, psychological, spiritual support to families and patients. Palliative care does not mean the patients are dying. Next question. What is the responsibility of palliative care nurse? The answer is palliative care neither hastens or postpones death. They provide comfort to patient and family, provides pain relief. Patient not necessarily close to death. Next question. When do we turn patients over for hospice care? Correct answer, the patient has less than 6 months to live. Next questions. What are the responsibility of a hospice nurse? Correct answer, comfort, reduce pain, administer pain medications. Please hit the thumbs up button. Please subscribe. Please share this video. Thank you. Have a good day.